Hello guys, myself Farshal Bairam Rathod. I am from group 4A and I am going to explain the drug ipratropium and tiotropium. As we know, ipratropium and tiotropium is anticholinergic drug. There are two types of nervous system: PNS, parasympathetic nervous system, and ANS. And sympathetic, and PNS consists of parasympathetic and sympathetic. The drug ipratropium and tiotropium acts on parasympathetic nervous system. So we explain the mechanism of it. Parasympathetic nervous system. Parasympathetic nervous system is like a chief minister. It gives command to a minister. So it acetylcholine. It gives message to acetylcholine. Acetylcholine then binds to M3 receptor. There are two types of receptors: muscarinic receptors and nicotinic receptors. Acetylcholine here binds to M3 receptor, muscarinic receptor. Muscarinic receptor then activates G protein coupled receptor. As you know, there are three types of G protein coupled receptors: GI, GS, GQ. In this case, GQ is activated by M3 receptor, and when G protein coupled receptor activates, it leads to smooth muscle contraction. Smooth muscle contraction. If smooth muscle contraction, it leads to bronchoconstriction. Bronchoconstriction. Here we are going to explain how ipratropium and tiotropium helps in emphysema, COPD, bronchitis. As we know, smoking is caused by, mainly COPD is caused by smoking. So in this case, the bronchoconstriction occurs. Ipratropium, tiotropium works on muscarinic receptor. It blocks M3 receptor, so further process will not occur. And it helps in bronchodilation. So asthmatic, COPD, and bronchitis patients, they get rid of bronchoconstriction. So ipratropium helps in these patients. So here we see the side effects and uses. Let's see the side effects of tiotropium. Anything in excess is toxic, as we know. Side effect includes dry mouth, constipation, muscle pain, stomach pain, and if we intake it is more than 100 ml or maybe 150 ml, vomiting may also happen. So vomiting is more common in this case. So uses: we use in following diseases: COPD, chronic obstructive pulmonary disease, which occurs mainly due to smoking. As we know, bronchoconstriction mainly happens in this case. Emphysema, the laborers which works in industrial, there is problem in them. Third, bronchitis, and most common, asthma. There are contraindications of this drug also. Contraindications. Let's see contraindications of this drug. Hypersensitivity of tiotropium. Sensitivity of tiotropium. And contraindicated in narrow angle glaucoma. So basically, ipratropium, tiotropium, it helps in asthmatic patients. It acts on M3 receptor. Summary: it acts on M3 receptor and blocks the M3 receptor, so further process will not happen. Smooth muscle constriction will not happen. Bronchoconstriction will not happen. So there is bronchodilation, and asthmatic, COPD, bronchitis, and asthmatic patients get relief. Thank you so much.